Patients considering breast augmentation have many questions about the procedure. Dr. Timothy Sherman, a board-certified plastic surgeon at the Iowa Clinic, answers some common questions.
Breast augmentation is one of the most common procedures that we do here at the Iowa Clinic in Plastic Surgery. We see a lot of women of a variety of ages who are interested in enhancing how they look. A lot of times it's women who've had children who've had some loss of volume, who just kind of want a more youthful look, kind of get back what they lost. Well, just about any woman's a good candidate for breast augmentation, depending on what they're looking for. Most of the times, they just want to look better in clothes. They want to be able to fill out a bra better, be able to wear different things. And like I said earlier, a lot of times it's just that they've had some changes in their body, either from pregnancy or weight loss, or just aging to some degree, and they just want to kind of look a little better than they had previously. We see a lot of women who even in their early 20s who will have breast augmentation because they just didn't develop like they would like, or they want to be able to wear different sort of clothes. And there's really no problem with that in terms of future pregnancies. It's not going to affect breastfeeding. There's usually not going to be a lot of changes with pregnancy that are going to cause you to have to do some sort of revision in the future. Probably 20 or 30% of our women who have augmentation haven't had children yet. I think whether you're looking for breast augmentation or any type of cosmetic surgery, you should find a plastic surgeon who is, first of all, board certified, who's well trained, who has some experience, and someone who is comfortable with the type of procedure that you want to have done. I mean, everybody has their sort of specialties, whether it's body contouring or breast surgery or facial surgery. And so, I mean, usually there's not very many jack of all trades. So, ask the questions. You can tell if they're comfortable with that or not. In a consultation for breast augmentation, we talk about basically a lot about what the woman wants in terms of how they want to look, what their body's going to allow us to do, because there are going to be some limitations. And yes, a consultation is really required. It's not one of those things you just pop in and have surgery. You want to have somebody who talks to you, goes through what your desires are, what your needs are, and tries to fit what you want to what they can do. And that's really important. And you want to be a partner in the process, and not just show up and have surgery, if you will. With any surgical procedure, there's going to be risks. With breast augmentation, they're relatively minor. There are some chances of bleeding or infection, but those are very, very rare. Probably the most common things we have are maybe a little bit of issue with the scar or capsular formation, which is some hardening of the breast, but that only occurs about 4% of the time. So it's a really very safe, very reliable procedure that requires, at least I think in our hands, very little revision. The recovery for breast augmentation is usually pretty well tolerated. The first few days, people are a little sore and do need some pain medications, but usually after 3 to 5 days, people are up doing things they need to do. I personally, and I know my partners also, usually keep somebody in a well-fitting bra for about 3 weeks for protection and support. And after that, they can get back to almost all their normal activities. But everybody's different. Some people are a little faster, some people a little slower, but for the most part, it's very well tolerated. The best information is they will, about 85% or more, are going to make it 10 years or better. And aside from that, there's really no maintenance to a breast implant. With augmentation, you can still do a good breast exam, either yourself or have a physician do that, although self-exam is very highly recommended on a monthly basis. In addition, breast implants don't interfere with mammograms. They may have to do an extra review, but for the most part they can see all the breast tissue they need to. So basically the answer is that breast augmentation does not interfere with a woman's ability to detect a breast cancer.
If you'd like to schedule a consultation with an Iowa Clinic plastic surgeon, please call our office at 515-875-9744.